don't care how much sex you're having. What I care about is, does it feel good? That's what I care about. So I'm gonna say something. I feel you, Michelle. I feel you. Quality over quantity, okay? But I'm gonna be real. So I asked my husband this. I was like, do you want quantity or do you want quality? Yeah. Because if you want quantity, the quality is gonna go down. But this was, I mean, if you want quality, then like be good with this whatever frequency. And at least that man, he was like, I'm gonna have to choose quantity. So what do you say to that? I would say, well, you didn't have to choose that. Yeah, exactly. You didn't have to make that choice. I'm on team. I am on team quality. Hello, good evening. Hello. I hope everybody's doing great this evening. I'm so excited for our conversation. So we're basically twins today. I just want to show everybody that we did not plan this, but we walked in wearing mustard yellow. We walked in with the same freaking lipstick. Essentially, we have similar taste in glasses, clearly. I love it. I think we look super cute twins, but it is my pleasure to speak today with Michelle Herzog. She is a licensed, certified relationship and sex therapist. She's also a dating coach, y'all. That's so I know so many single people who probably need your services. Okay. Probably. Dating coach. And she is an entrepreneur and owner, a female boss. She's the owner of her own practice, the Center for Modern Relationships here in Chicago, which deals with a host of sex therapy, sexual dysfunction, relationship, couple stuff. And we are going to talk desire today. So thank you for joining me, Michelle.
Thank you for having me.
You're welcome. Yay. You're welcome. Tell a little bit about yourself really quick to our audience.
Yeah, so Dr. Milhouse got all of that correct. I'm a licensed relationship and sex therapist. I own the Center for Modern Relationships here in the city of Chicago, and we work with folks all throughout Illinois who are looking for sex therapy, couples therapy, and therapy for dating. And we work with individuals as well who are struggling with sex and relationship issues. And we're both online. Yep, so not just couples. So we're online and in person. So even if you live, pretty far away from the city of Chicago, we offer online services. So,
all right, let's get into it. All right, what is desire discrepancy?
Yes. So desire discrepancy, also known as desire differences or desire, mismatch, is a really common dynamic in couples, specifically in people who have been together for a long time. Essentially means one person wants to have sex more frequently than the other. Again, a totally normal dynamic. So normal that 75% of the people who reach out to our practice for therapy are experiencing some kind of desire discrepancy. So
75%.
It is the most common thing we see.
Got it. And what impacts desire in general? As a sex therapist, what would you say impacts our desire?
So that's a big question. And it's a big question because there are so many things that can impact desire. The first thing I want to say is, it makes sense that two different people are not feeling desire at the same exact time, right? So I just want to put that out there for those of you who are listening. So things that impact desire can range from relationship issues, medical issues, things like stress, things like anxiety, so mental health issues, things like feeling like you're carrying the load in your household and you have no help. Okay, that's called the mental load as well. So several issues, trauma. I mean, the list goes on and on and on.
Every person that I see that has desire complaints, and even sometimes when they don't, I'm asking them a series of questions. I tell them, I'm about to be nosy. It's going to sound like I'm nosy. It's going to sound like I'm in your business, but it's important.
Yes.
And I'm asking them, do you like the person you're having sex with? I know you love them, but do you like them? Do you like yourself? How do you feel about sex? Do you feel guilt or shame? Are you getting good sleep? How's your rest? How's your stress? Does sex even feel good? If sex is painful or just kind of not up to a pleasure that you would like, you may not want it, right? And so I get into that and those weeds a little bit because I'm kind of screening for the person who I need to send to you.
And this is where sex therapy can be really important. Having a space where you can talk about those feelings and be vulnerable and express what it's like to be the lower desire partner in the relationship or be the higher desire partner in the relationship is really important.
I think we should stop there and kind of tell the audience, like, what does desire discrepancy or, sexual rejection, if you will, I don't know if that's a kosher term, do for a relationship? Like, what are the potential negative? You kind of touched on it. Like, people feel lonely, they feel unwanted, rejected.
Yeah.
Like, talk about what it does potentially.
Yeah. And, this is the side of our work as sex therapists that I think is kind of sad. People will harbor resentment over time if their sexual needs aren't met. That like someone can only take so much rejection right before they start to internalize it. Someone can also only take so much I am the problem, right?
Yes.
Before they start to internalize that. I mean, it goes both ways. So what I typically see is, obviously everyone's different, but what I typically see is people in a desire discrepant situation where they've been in this for a long time, they've kind of disconnected from each other, maybe don't have as much fun together, they're not really communicating as much. These are some of the symptoms that could happen with desire discrepancy. I've also seen it on the complete other end where partners are best friends, they love each other so much, they are super affectionate, but the sex just isn't there. In either situation, sexual communication, critical, and really being able to express a need and do that in an empathetic and non-critical way is super important. And things that we talk about in sex therapy are, moving away from like how much sex we're having, but moving more towards the quality of sex that you're having. I don't care how much sex you're having. What I care about is, does it feel good? That's what I care about.
So I'm gonna say something. I feel you, Michelle. I feel you. Quality over quantity. Okay. But I'm gonna be real. So I asked my husband this. I was like, do you want quantity or do you want quality?
Yeah.
Because if you want quantity, the quality is gonna go down. But this was, I mean, if you want quality, then like be good with this, whatever frequency. And at least that man, he was like, I'm gonna have to choose quantity. So what do you say to that?
I would say, well, you didn't have to choose that.
Yeah, exactly. You didn't have to make that choice. I'm on team. I am on team quality. I'm on team quality. Okay.
Yes. Yeah.
Okay. Drop in the chat, team quality or team quantity.
You all know, like when you're in sex therapy, intervention, I can call them interventions, right? They are specifically tailored to your situation. So there's not like a one size fits all approach, but there are things that you can start doing that I think could make a difference. If your sex life is not what you want it to be, if you feel like you're not having pleasurable sex, or if you feel like the sex you're having, just really isn't what you want to experience, or you're not having sex at all, it's so important that you reach out to your partner, and we call it like a bid for connection. Like you ask like, hey, can we talk about our sex life? I'm starting to feel really concerned, or I'm starting to feel lonely, afraid, right? Like use those words. Don't use I'm mad or I'm pissed at you or like you suck. Like don't say those things, because then partner's probably not going to talk to you about it.
Correct.
Right? You've got to be gentle and you've got to be real. Just like talk about how it feels to, feel disconnected sexually. So step one, always communicate how you're feeling and what you want, like what you need. But if you can't get beyond a conversation about it, then I would highly recommend seeking sex therapy, because at that point, I think a professional really needs to be a part of the equation to help you navigate the discomfort that you're both feeling around this dynamic. And I think that's super critical.
What are the specific interventions that you might give a couple suffering?
So again, it depends on kind of where you are. So typically what we would assess for is like, all right, can you talk about sex? And we also assess for like, do you even know what you like? I think that's really critical. So something that we might do early on on in sex therapy is give you something called a yes, no, maybe list. Okay. So I love these because it gets you thinking about what you like sexually, what you definitely do not like sexually, and what you're open to sexually. Okay. So typically what we
sounds
do,
fun.
yeah, I mean, you can do one right now. It could take you 5 minutes. It could take you 3 hours. I don't know. It
Yeah.
just depends. But so typically what we would say is, okay, I want you to get out a piece of paper. I want you to do 3 columns, yes column, no column, maybe column, and all of the things that you love sexually, things that make you feel good, things that get you excited, things that when you think about them, they turn you on, everything that you like goes in that category. Okay. And then there's the no category. There's like the absolutely hell no, do not come towards me with that. I don't want that. That goes in the no category. And then the final thing is the maybes. So maybes are things that you've maybe heard about and you're interested in trying, or maybe things that you've tried once, but it was a long time ago and you kind of want to like see if it is something you're interested in now. So that's a yes, no, maybe list. Those tend to be really helpful for couples and also really great to start communicating around because then we share them.
I love that.
Like, all right, show us your list. Like, what do we got? Because what we'll then do is we'll say, all right, let's circle the things that we align on, right? And now we can start focusing on those things in this relationship. So that's like an early intervention that we might do with the couple.
I love that, by the way. I think that's a great date night activity.
Oh, totally.
Even if you guys are completely simpatico when it comes to desire. I'm totally doing that next time for my date night. I'd love to see and compare the list of the yes, no, maybe. So thank you. That's
You're so
wonderful.
welcome. And you might learn something about each other.
Yes.
The other thing I want to say about that is, you know, if you have a hard time coming up with things that are like in your yes category, what I want you to do is I want you to close your eyes. I want you to think about a time in your life where you, and it doesn't have to be with your current partner, it can be at any time, okay? A time in your life where you felt the most turned on, the most sexy, the most sexual. And I want you to think about what was happening.
Yeah.
Like, what were you doing? What were you feeling? Like, what were you thinking? And put those things in your yes category because it's very likely that those are the same things that you might respond positively to now. Fantasy works.
It does. It does. So, you know, get you a wig, you know what I'm saying? Get you a little outfit, be somebody else for the evening. I'm totally serious. I'm totally
I know you are.
For role play and fantasy play, just be somebody else for the evening. Okay. Get into it. Absolutely. Okay. And this is a question we got. How does one go about trying to figure out what may be the root cause? For example, I've talked to my therapist and psychiatrist, and in case it's my meds, her psychiatric meds, my doctors don't seem to really be open to my low libido since I do have other health concerns. So at what point is something that can be dealt with? Is it until certain medical concerns are fixed? Or are there other ways to actively work on improving my libido along with my other health concerns, like, for instance, being overweight?
What do you think?
Okay. Sexual complaints are often brushed to the side when you talk to medical doctors.
Yes.
Okay. Often brushed to the side. Partly because in healthcare, we are like constricted by time, which isn't a good enough excuse, but that's part of it. Part of it is we don't know how to help an individual. We don't know what to do about libido. And so when we don't know, we don't have time, it's like, it's not as important as your other one, things. It's important though, that just like obviously maintaining a healthy weight and high blood pressure, diabetes and all that other good stuff that you see your doctor for and treating your anxiety and depression, that your sexual dysfunction complaints are part of your quality of life. Okay. Sexual health is health. Okay. And so if you are really bothered and not getting any kind of answers, not even getting, hey, I don't have the answer, but here, let me show you how, let me refer you to somebody who does. You need to advocate for yourself, okay? You absolutely can and should be able to tackle this issue along with your other medical issues at the same time, okay? Absolutely. You just need to get the right attention. And unfortunately, the right attention can sometimes be difficult to find in medicine and healthcare. We know that psych meds can be a very common cause of sexual side effects like low libido. Not to say dump your psychiatrist and dump your psych meds. Please don't do that. Do not do that. Okay. All right. You need that guidance. but maybe you can bring up, are there alternatives for me with these meds? Are there alternative medications that have less side effects? Can we take a holiday? Can we talk about, is it possible that I can wean or lower dose or any of these things? But please do this under the guidance of a professional that's prescribing this medication.
As a sexual health professional, I understand the frustration that clients experience that we see in therapy with kind of being bounced around, between medical providers and not really having access or knowing where to look for, a qualified sexual medicine doctor. So the good thing about working with a sex therapist, we know those people. We do, because we are always looking for trusted medical professionals that we can send our clients to get answers, right?
This is a joint adventure. It's not like you see one or the other.
Right. This is collaborative.
100%. And I tell my patients that I send to sex therapy, I'm like, I'm telling you, the combination of my prescription medication, whether that's hormones or one of the FDA-approved medications like bremelanotide or flibanserin, plus you sitting and talking with a sex therapist, the combination will do wonders, either one individual. Okay, so I really harp on that. Let's go on to the next question. Does low testosterone really cause a man not to desire sex or to be attracted to his mate anymore? My partner has low testosterone and is being treated with testosterone gel. In the 5 years we have been together, he has gone from being hypersexual the first year to me literally have to beg for sex the past 4 years we've been together. It's like I'm invisible. No initiation, no reaction when I try to spice up the mood or put on sexy things. He also takes Cialis 5 milligrams a day. This is for erectile issues potentially. Although there is erectile dysfunction, he does not have a problem getting an erection now that he's presumably on Cialis 5 milligrams a day. So, does low testosterone cause you to go from sex all the time to completely asexual? The answer is desire and hormones are not an all or nothing phenomenon. It is not a light switch. It's not like you have normal testosterone and switch, you definitely have desire, or you have low testosterone and switch, desire's gone. It usually is not like that at all. Okay. And there's a spectrum and a gradient. And then in fact, sometimes we find that even though maybe testosterone may be low, patients aren't complaining of any desire issues. So it's not even 100% reliable as far as predicting, is this patient going to have libido issues or not?
If you have concerns about not being sexual with your partner, the best thing to do is to softly and vulnerably bring those concerns to your partner. If you already have, great. If you haven't, it's, hey, I'm really struggling with the fact that we're not sexual anymore. That's really painful for me. I miss you. I miss connecting with you. And I want to prioritize this. Is this something you are willing to do with me? And again, and I said this earlier, if we hope that they say yes, and if they don't, then, you have some choices to make there. Like you can go to sex therapy on your own and hope that the work that you do in sex therapy facilitates some change on your partner's end because you're changing in whatever way. Typically, when someone has a low desire, they don't feel good about that, right? Like they struggle with that. And especially men, because men are socialized to be these like masculine, like sexual, like aggressive people. And I think that's a disservice, but
that's a whole other
talk.
Life.
But men are socialized to like be these sexual beings. And when they're not, I think that there's a lot of internal turmoil that they can experience. Like, I'm not good enough. I'm not man enough. I'm not pleasing my partner, because that's the pressure that men get, and women too. I'm not pleasing my partner, right?
Yeah.
So I guarantee you there is an internal story happening for this person that probably doesn't feel good to them. And again, that's really where I think therapy can be useful.
All right, this is a longer question. Okay, I know the majority of time, women within a heterosexual relationship are the ones with the lower sex drive compared to men. I happen to be a woman, never married, no kids, who is blessed with a fairly high libido. And for most of my 8-year relationship, 7 of which were long distance, my partner, 42, also never married and no kids, did quite well in matching it, helping me to explore my sexuality even further than I had in previous relationships. So cool. Well, yet now we finally live in the same city. Right before I moved, he admitted his sex drive had really diminished and he doesn't even masturbate as much. He blames the stress of a new job, the fact that he's on Rogaine, which he still has great hair. I love that she adds that, and admits to not feeling comfortable with his body. although he started working out with a trainer more recently. I also know the move made him apprehensive since it was a big shift and he's not comfortable with change. I, on the other hand, have never felt better about my body. I'm someone who works out a lot, whose love language is physical touch. So needless to say, all I crave right now is to have sex with the person I love. He won't go to the doctor to figure out the issue. Maybe it's low-grade depression since he has no problem performing when we do have sex. So the mechanics, the machinery works fine. I don't want him to feel like I'm pressuring him. That's good. But I can't help but feel like there's a little bit of role reversal right now where I'm the guy in the relationship begging the woman for sex. What can I do to let him know in a supportive way that I understand relationships have their ebb and flow and help guide us back to some form of where we were? I feel that now that we're finally in the same place, we deserve to have a wonderful, passionate sex again. Oh. Yeah. I like that this person is insightful enough.
Very insightful.
And considerate about their partner. You didn't hear a lot of I want this. It's like very gentle. It's so cute. She even compliments her partner in the
I know.
I love it. He has great hair.
We can tell if you're here. We can tell you love this person.
We can tell you do. I love the little side things.
So this is your opportunity to do a bid for connection and ask, is this something we can work on together? It's so important to me, especially now that we're like living in the same place because you were in a long distance relationship for so long. Can we work on this? This is so important.
And I love that term, a bid for connection. Remember that, a bid for connection.
Bid for connection. Yeah. And maybe if your partner isn't ready to dive into sex therapy, you can read a book together. You can watch educational videos together about sex. There are a lot, you can listen to erotica together. Like there are so many options. So I'm going to throw some books your way that might be really useful.
Okay.
The first one is called Come As You Are by Emily Nagoski. I think that would be a great one to start with. She's also coming out with a second book next month, which is written for couples who are experiencing desire discrepancy.
How do you spell her last name?
Nagoski. She's fantastic. Follow Emily. She's lovely. There's a second book coming out called Come Together. So that might actually be a great book for the two of you to read together so that you can really understand. Same author. So that you can really understand as a couple why you've gotten to where you've gotten today. Okay. And then erotica. I love erotica for people. I always recommend listening to erotica because this.
Are you just saying erotica in general?
I love, erotica in general.
Okay, got it.
But there's an app that I'm going to point people
There's
towards.
an erotica.
So sometimes we need to like stimulate our senses. So we want to maybe listen to something sexy or watch something sexual. So you could also introduce an app called Dipsea. It's VIPSEA.
Okay.
Dipsea. And it's a erotica app where you can listen to like 10-minute, 12-minute erotic stories. They're like read by actors. Like,
what is it app called?
Dipsea. DIPSEA.
SEA.
There's a free version. And then obviously like the paid version, you get like way more access to things. And it's broken up into categories like lesbian erotica and threesomes and kink and, one night stand. They've got like everything. It's like fantastic. So I definitely recommend that if you and your partner are interested in exploring some of this stuff together to see if it kind of stirs up some arousal. If you like porn, I like to point people in the direction of ethical porn. Okay.
Ooh.
So Bellesa is a really good ethical porn website, but there are lots of ethical porn websites out there.
How do I spell Bellesa?
I think BELLESA.
Ethical porn.
I think. There's putting on blindfolds and bringing in different scents to your bedroom or, bringing in different like feathers and like lace and silk and things like that.
Okay. So then the other one, my friend is about to get married in 3 months, but now she feels she's asexual. What should she do?
Ooh, she should talk to a sex therapist about that.
Yeah.
Yeah. So, asexuality it's an identity. Okay. And I would absolutely encourage your friend to talk to a sex therapist who specializes in asexuality to really explore why they feel they're asexual at this point, because what we would explore is like, is it asexuality? Is it low desire?
Yeah.
Are there other contextual factors going on in your life that might be contributing to you? And the other thing is like asexuality, like a lot of things can like be on a spectrum, so there's nothing wrong with that, but I would definitely encourage speaking to a therapist about that.
Thank you, every one of you, for spending your evening. I really hope you gained a lot from here, a good starting point, and you most importantly know the importance of mental health therapy for sex therapy. I think a lot lot of times when people hear sex therapy, they think it's kind of kooky
It's
and
not.
it's for sexual deviance.
No.
And it absolutely is not.
No,
Yes.
we are expert relationship and sex therapists, meaning we have hundreds and hundreds and hundreds of additional hours of education post graduate school, because we don't get it in grad school, specifically on how to treat sexual issues. So we exist. We are here for you. There aren't many sex therapists in the United States. There's like maybe 1,200 of us total, but they exist. Look for us. You deserve
Asec.org.
healthy sexual health. Yeah,
You do.
asec.org.
asec.org. You deserve it. Sexual health is health.
Sexual health is health.
Bye,
Right.
twin.
Bye.
Good night, everyone.
Bye.